Hey, it's Dr. Centeno, and I've seen a really disturbing trend out there that's going to get a lot of providers in a lot of trouble. And that's billing Medicare for amniotic and umbilical cord products because there is a, quote, Q code. So a Medicare Q code is nothing more than a way to get reimbursed for a product that's used during a procedure. And this is something I recently found by this company called Total Ancillary. And it's just one of the many, many companies that are doing this. But basically, they have you submit a little form. They then determine what the right codes are to use to get this thing paid, basically. I talked to them on the phone, and that's how it was described to me. The problem is the real step-by-step process is a little different. They're talking about Medicare authorizations. There are no Medicare prior authorizations. That doesn't exist. All they can tell you is the patient has Medicare or not. The doctor then places the order for the biologic product, and then there can be real problems after that. So Medicare payments. Medicare will pay any claim that has the right code combinations. There's no prior authorization. And if you screw up the coding, you're subject to a clawback, which is pay back the money. Or if you're doing it willingly, you're subject to federal prison. That all happens through what's called a RAC audit, which is a contractor hired by Medicare to get money back. And you've got to basically make sure that you're submitting something to Medicare that should be billed that way. So this is how Medicare Q codes work. If you've got a product with a Q code, you got to know through this LCD, this local coverage determination, if your version of Medicare, your MAC, covers that. And if you submit the right codes, regrettably, Medicare will pay you, even when they shouldn't. And regrettably, there will be RAC contractors who will find that. And then when they determine it's not really covered, if it's willful, it's go to federal prison. If it's not willful, they'll make you pay the money back with interest. So what's a local coverage determination? That's with each local version of Medicare. It determines whether or not, for instance, in this case, amniotic tissue can be used for, let's say, knee arthritis. And there is no LCD for any MAC I'm aware of that covers amniotic or umbilical cord products for arthritis, tendonitis, chronic pain, or spine. So that means that you cannot bill these items this way. There is no prior auth that you can get that'll make this all right. You, as the provider, are the one that's got to determine whether or not this is legal. And if you screw it up, even though you might get paid because someone got the right combination of codes, you're at risk for a RAC audit and federal prison time. So be very, very, very careful here. I can't tell you enough that this is a nightmare waiting to happen. And please, please, if you're a patient, realize that if you get this stuff covered and the doctor's got to pay back the money, guess where the doctor's coming to for that money? They're coming to you. So thanks so much for watching and have a great day.